right now, we are looking at an outbreak that is even more contagious than Ebola right here in America, and that is measles. Here is what we know so far about the measles outbreak that started in Disneyland, California. Okay. So the week before this past Christmas, the week before Christmas 2014, visitors to Disneyland started coming down with the symptoms of measles. And just to kind of give you guys a perspective on what that is, it's 4 days of high fevers and the 3 Cs. And this is something that we're taught in medical school about measles. And even though very few of us are going to see this disease in our career, the 3 Cs are cough, conjunctivitis, and coryza. Coryza is this fancy word that we use in med school. It really applies to like a bad head cold, like a really bad head cold, sore throat, runny nose, that kind of stuff. So 4 days of high fevers, and then you got these 3 Cs. And people started coming down with all these symptoms after going to Disneyland. And now this outbreak has spread to 85 people in 7 states. And it's because this virus, spreads quickly among people who have not been vaccinated. And those 7 states are California, which has the bulk of the outbreak, Oregon, Washington State, Arizona, Utah, Colorado, and Nebraska. So it's reaching pretty far. And to help us learn more about this outbreak, we're going to be talking with Dr. Jonathan Auth to give us an update from Orange County, California, and to teach us what we need to know about the outbreak and what we need to do to stop the measles. So, just to give you guys a little bit of background about Dr. Auth. Okay, Dr. Jonathan Auth was born the second of 8 children in Twin Falls, Idaho. He received a Bachelor's of Art in Biology from Yale University, after which he worked for the NIH, that's the National Institutes of Health, in the National Institute of Child Health and Human Development. He went on to receive his medical degree from the Keck School of Medicine at the University of Southern California in 2004, and then completed his pediatric residency training at UCLA. And that's actually just, side note and full disclosure, Jonathan's a really good friend of mine from residency. We did our residency training together at UCLA. He's been a really good friend along with his wife, Melissa, and the two of them are both pediatricians. He's a general pediatrician and she's a pediatric neurologist. They both live and work in southern Orange County, where very close to where the measles outbreak started. And he's a practicing general pediatrician. He's, the parents of, they both him and Melissa are the parents of 2 beautiful kids, Emma, age 4, and Ethan, age 18 months. So we're really pleased to have Jonathan on the program. And Jonathan, thanks for being on the show.
Yes, good morning. Thank you very much for having me.
I know it's early out there, man. Thanks a lot for joining us. Really appreciate it.
No, it's no problem.
All right. So I know that you and Melissa are in Orange County, California. It's home of Disneyland and the starting point of this measles outbreak. And, you guys are both pediatricians, parents, big fans of that theme park. What has this outbreak meant to you? Like, what are you seeing in clinic and what are you seeing in your community?
Yeah, well, we're certainly seeing a lot of fear. A lot of questions are coming into the office. Families, for the most part, who are vaccinated and who are asking, how is this going to affect their decisions to go out into the community, and not just to Disneyland. Certainly that's a common destination for our families, but, even going to the mall, I think there's a lot of fear out there, and it's in people who are vaccinated. They're vaccinated already one time, and, they're asking, do I need to limit my contact? Do I need to get that second vaccine sooner? It's definitely on people's minds.
Yeah, yeah. So why don't we take a step back and talk about the measles virus? Hopefully, getting to understand this disease will help a little bit because I don't want to scare people and send us into that panic we saw with Ebola. But there are some important things that we need to know about this virus. And from what we do know, measles is not as deadly as Ebola, but it's much more contagious, right?
Yeah, the problem with measles is that something like 90% of people who are not protected, not immune to the disease, if they come into close contact with a infected individual, 90% contagion rate. So 90% of those people will end up getting sick from the disease. And it's an airborne disease, so it lingers sometimes in the environment for maybe even a couple of hours after the infected individual has left. So you don't need that high level of direct contact in order to become infected.
Right. So, okay, so that actually makes it a big difference from Ebola, where you have to have actually had some contact with like infected bodily fluids and actually be in very, very close proximity to the person because Ebola is not airborne, but measles is.
Correct.
Okay. And, but what makes measles, because it's not as deadly as Ebola, but what makes it a big deal? Like, what are the consequences of getting infected?
Well, historically, mortality rates from measles, in the era prior to modern medicine, were extremely high. It was a leading cause of death and a reason, back in the early part of the 20th century where people were very fearful of their lives for this. I mean, by some estimates, as many as 20% of people infected with measles may succumb to the illness eventually. In today's modern era, where we've got better access to medical care, interventions have certainly lessened the mortality rate, but still complications are high. Something like 10% of people who contract the measles disease will have a complication, and it can be something as benign as an ear infection or pneumonia. Something like 10% of people who get measles disease will end up having pneumonia and end up needing to be hospitalized frequently as a result of that. Brain injury actually is a significant problem. Swelling of the brain can occur after measles, and that can occur even years later. It's not necessarily an acute complication, but still, even in 2015, the mortality rate from measles is about 1 to 2 cases per 1,000, which for a disease which is completely preventable. And in fact, in the United States, over the time period from 2000 to 2011, not a single domestically acquired case of measles occurred. So for something that's completely preventable, which we've shown could be the case with measles, a mortality rate of even 1 in 500 is just completely unacceptable.
Yeah. So actually, I want to rewind just to like a point that you were saying about before this outbreak that the way that Americans were catching measles was actually not in America. Could you just sort of elaborate a little bit on that point?
Yeah, so the measles vaccine was introduced, back in the early 60s, and we saw slowly and steadily declining rates of measles from that point through until the turn of the century. And in 2000, the United States declared that measles was eradicated in the United States. We had sufficient vaccination against the measles, and we just weren't seeing cases in the United States. The only people who really were diagnosed with measles were people who had confirmed travel outside of this country. So it really was a public health, really triumph in terms of eradicating this disease. And we've seen this, in the past with a handful of other problems, smallpox, for example. But then increasing rates of non-vaccinators, for a variety of reasons, had sort of taken root. And what ended up happening over time is patches in the population where vaccine rates were sufficiently low enough allowed measles then to take hold once again. And unfortunately, Orange County in California is one of the areas in the country with the highest rates of non-vaccination. And in fact, if you go to, some of these public school systems in Orange County, you may see non-vaccination rates specifically against the measles as high as, 16%, which is just, completely ridiculous that would be allowed to happen. But laws in this country and in this state have made it easier and easier over the course of the years for families to opt out of doing vaccines. And it's really unfortunate.
Yeah. So, coming back to that, to that 16%, I know that, for some of our viewers, that doesn't sound like a very high number, but, I think that what helps, to help, folks understand about like how herd immunity works is that, that's kind of the, like the beginning of the crack in the dam, like that little like number of like, 10%, 16%, like these,
Sure.
like, I mean, it might not sound like an impressive number, but it's enough people where you are giving a germ like the measles virus an opportunity, right?
Absolutely. It doesn't take a lot. I mean, for a virus that is as easily spread as the measles, that's the thing you got to remember. When 90% of close contacts can contract the measles, you have to have a very, very high rate of protection in order for that virus not to be able to take hold and really spread. So if you've got a disease that has a much lower rate of transmission, you don't have to worry about having these mega high rates of immunity. But with measles, 90% of non-immunized or non-protected individuals in contact will get the disease, and that means you must have very, very high rates. And many the epidemiologists have kind of looked at this, and they said they estimated somewhere between 94 and 96% of the population needs to be immune in order for the vaccine to really do its job and completely, remove measles from the face of the planet.
Right.
So that's really a big part of what had led public health programs to make a transition from a single vaccine, which was introduced in 1963 and continued to be the norm until about 1990. A single vaccine was all that was advised for patients to get immunity, and that was about 95% effective. But in 1990, after looking at the data, the public health folks really determined that we needed to do better. And so they increased the recommendation from a single vaccine to a booster vaccine. And that booster vaccine increases the effectiveness from 95 to 99%. And by doing that, even though we may not reach, the goal of 100% of people vaccinated, we get higher rates of vaccine take within the community. And that is what really, between 1990 and 2000, allowed the United States to declare itself measles free.
Right. And actually, I'm glad that you brought up that point, because I think, for some of our listeners, there may have been some of that confusion, right? Because even for guys like us who grew up in that time period that you're talking about, we got like one measles shot, and then, you're
Right.
watching your own kids get two. And I think like it really does kind of help understand like what the logic and reasoning that, we wanted to go from like rates of public immunity from 95% to, like you're saying, like 99%. But again, like those percentiles, like that's applying to the country. You're in Orange County, and it sounds like you guys are like at, I don't know, 84, 85%. Like it's pretty scary, man.
It is scary for sure. I mean, I think, people who are unvaccinated should really be, thinking twice. They need to be reconsidering, and they need to be hopefully, making smarter decisions based on, what the science and what the fact of the matter is really telling us. I mean, the public health department here in Orange County has recently released recommendations, and they've sort of said parents of children who are not vaccinated against the measles, and that includes, infants under age 1, that they should be very cautious about going out into large areas with large,
with like large
populated
crowds.
large groups
Yeah.
of people. Yeah,
Yeah.
exactly.
So I mean, and just like you were pointing out, at the beginning of this conversation, like that's not just Disneyland. Like that includes like malls, movie
Yeah,
theaters. I mean,
yeah,
like a lot of
absolutely.
places that people spend a lot of time in.
Absolutely, and I think if this really lights a fire under the non-vaccination movement to really reconsider and think twice, and really look at the data again with a more objective eye instead of the eyes of fear. I mean, I think we need to put this thing into perspective, right? I
Hmm.
mean, in Orange County in 2015, the total number of cases of measles that's affected Orange County residents is 25. I mean, that's not a huge number, all right? Population 3 million in Orange County. I mean,
Right.
while we talk about 80 cases linked to the Disneyland outbreak, a lot of those are travelers or people from other states or other parts of California. And so it's a big deal. I mean, these are numbers which are not trivial,
Right.
considering we had, more than a decade of zero.
Yeah. Right.
In 2014, the United States, I think 640 was the total number of documented cases of measles. So, I mean, this is still a small number. I don't think people should be afraid of the measles, especially if you're vaccinated against it. We need to put it into perspective. These are still relatively small numbers, but they're the canary in the mine. They're really
Right.
sending us this message that we need to be more careful. We can't be as tolerant of lackadaisical approaches when it comes to vaccination. Vaccinations, are the single most valuable development at saving lives from a public health standpoint. They are far and away the most valuable thing. I think most experts agree that we do, and it needs to be something that we take seriously.
Right.
As an individual, you want to make sure that you can protect yourself, your family. The science supports the safety of vaccines without a doubt. And I think the other thing that's interesting is we really need to take a look at vaccination against these highly communicable diseases as really a part of your social responsibility. I mean, it's not just about protecting, your loved ones. It's about participating in the community and doing your part to protect everyone else, because that is really what herd immunity is about.
Right.
We know that not everybody can be vaccinated.
Right.
Something, if you have certain conditions or immune compromised, the vaccine may not be appropriate, or you may not be able to take hold of it. If you're under age 1, the vaccine does not work very well for you.
Right.
And so,
right. And we have examples of this, right? Like, you and I have, taken care of, kids where they've got like peanut allergies. And, now we're seeing more schools where like they won't even serve peanut butter in the cafeteria because, they're trying to, protect, these few children with the peanut allergy, even though the majority of the kids don't have that. And, and these are the things that we do for each other as, as a society, that, we don't let the few vulnerable just fight off the wolves by themselves. And, I think that I'm glad that you're bringing up this point about the social responsibility, because I heard in California that Governor Brown has tried to, make opting out of vaccines a little bit more difficult for the parents who are trying to send their kids to school. Can you tell us a bit more about that?
Sure. Many states in the country actually have vaccine exemption laws where, as a parent, if you decline to get your child vaccinated based on religious or philosophical grounds, you can essentially not have your child vaccinated and still attend public schools. There are some states that don't allow for that. It's like you have to get your kid vaccinated and there's no way around it. But historically, over the past 20 years or so, California had made it gradually easier and easier for families, without really providing very solid grounds, to not give the vaccine, not to give any vaccines, in fact. This past year, Governor Jerry Brown signed into legislation a clause that essentially made it harder. And what is required now is any family who attends a public school system who does not want their child to be vaccinated against any of the required vaccines they must consult with their physician, and a physician actually has to sign off on a special form that says we've counseled the family on the risks to your child and to the risks of the community of not vaccinating. And, part of, many pediatricians have actually taken the stance and said, you know what, I'm not going to sign this form. And we're seeing more and more pediatric practices, I think, taking a little bit more aggressive responsibility for this problem and trying to really reverse it by saying, we're not gonna see families who don't vaccinate. It's part of our social responsibility. It's part of what we as physicians feel is in the best interest of all children, all people. Mm-hmm. And if you're not going to participate in that social, health policy, then you're just going to have to find a different medical home. And I think to some degree, as pediatricians, perhaps we've contributed to this measles problem. The family-centered health model that's taken hold over the course of the past couple of decades, where we really try to incorporate the families into medical-making decisions more and more. Mm-hmm. Gone are the days where people just blindly follow their doctor's recommendation. Right. We really are trying to bring the family and make them understand what's happening. It's about making that decision together. And when too many families are, not wanting to do vaccines, we, as a pediatrician, we want to still be there to support them, and we want to help them kind of navigate through that decision. And all too often, I think we allow that to happen. Even though we've done our best to convince them, we allow them to make those decisions, even though we feel in our hearts, we know the medical science says it's bad decision-making. And we've tolerated it. We've been accommodating to families. But I think what you'll find over the coming years is a growing intolerance at the physician level for those families who choose, to clearly avoid the medical evidence, to really deny the fact that vaccines are effective and vaccines are safe.
Right.
A big part of this is fear. It's fear that was in large part brought about around the dawn of the internet era and really propagated by autism. I mean, autism rates are climbing and climbing for a variety of reasons, but people fear this association between vaccines and autism. And it's been debunked. It's been proven time and time again. That's not happening. It really isn't. And the message is getting out there. I mean, they're hearing it, but they're slow sometimes to really accept that, because fear can be a very powerful driving motivator. And I think the best thing that we can do is, as physicians, is really, state the facts, be clear, be concise, be, steadfast in our dedication that this is the way to go. And, I think as parents more and more, in their interactions with the community and with friends and family, hear that message time and time again, resonated by everyone, the message will finally get home. Yeah. Hopefully, the few physician detractors who really, are a minority of physicians out there who don't recommend the standard vaccine protocol, they'll have less and less a voice, and people will hear more and more what the reality for the facts about vaccine are.
Right. Well, Dr. Jonathan Ott, thank you so much for joining us on the show. I really appreciate your perspectives and reminding us that, vaccines are not just good for our own individual health, they're good for our society's health, our family's health, and that they really are a part of our social responsibility. And I think you're absolutely right. This message is starting to resonate with people. And, I really appreciate your hard work, and, give Melissa and the kids my best. And hopefully we'll have you again on the show real soon.
I'd be real happy with that. It's real nice to talk with you today.
All right. Thanks a lot, man. We'll
take care now.
Okay. And when we come back, I've got a special message for the Anti-Vaxxers. You've been listening to Dr. America. I am your host, Dr. Sanjeev Sriram, on the We Act Radio Network, and we'll be right back.